name's James Richardson, and I'm the infectious disease specialist. We consult and help doctors out in terms of taking care of infections. So I can be helping the oncologist, I can be helping the hospitalists, I can be helping the neurosurgeons or the orthopedic surgeons on difficult infections. So they call me in because that's my specialty. I take care of really difficult to treat infections. In a physician's brain, what makes you an artist also too makes you a clinician too as well, because you take things that are incomplete and you make a complete story with that. And the same thing we do with art is kind of the same thing we do in medicine. I'm actually not a trained painter. I'm not a trained artist. When I was going to school, I had too much time I had to devote to the sciences. But I will say that my brother is a professional artist, and when I would take him to art school, I would go and study in the library. But I would learn a few things from him. So I'm not really a trained artist, and I've never had an art class at all. But what makes me a good physician in terms of recognizing detail and shading and that sort of thing also too makes me a good painter too as well. And so I noticed that before all the digital age, when I would do diagrams, my diagrams are a little bit better than everybody else's, mainly because I was paying attention to the details. I was already doing the things that an artist would do. And so when I got here to Texas, I had a little bit of time on my hand, and I started doing just pencil drawings. And for a year, all I did was number 2 pencil and portraits. And so I would draw the person of the day. I had all these political figures that I drew, and after a while, I got to be really good at it. And my wife said, "You ought to add some color to that." So then I started adding paint. Then I went into watercolors, and then also acrylics. I don't do any oils, but I seem to like the watercolors. The colors are so much more brighter and pleasant to be around. I'm a nocturnal painter. So during the day, I'm a physician, and then when I go home at nighttime, I may paint a little bit before I go to bed, and then when I get up at nighttime to let the dogs out, then I'm usually awake, and that's where I'm most productive. So I usually will paint like an hour and a half during the middle of the night, and then go back to bed and start my day all over. I tell people, once in a while when I have time on Saturday or Sunday afternoon, I may paint a little bit. The fun thing about the watercolors and why it suits what I do is I'm like most guys. I'm easily distracted, and so I'll paint a little bit, and then the nice thing is I have to set it aside if the watercolors let it dry, and so it takes time for that to dry before I move on to something else. Sometimes I look upon it as a challenge, and I'm always looking for like the next challenge and the next technique or technique or tool that I can learn in order to do something a little bit better. So it's kind of a challenge. All the rooms have a different theme. We have Van Gogh out here. I've got some American Southwest in one room where I have Southwest art as well as Indians. I went through a period of time where I painted old rusty trucks in the desert. But yeah, it's been a fun journey for me. As I said, I'm still painting and still looking for different things to try and do.